patient should know what the ideal treatment plan or ideal treatment is for them. So don't use insurance as your basis for treatment planning or anything like that. Really focus on what that patient needs.
Hello, my name is Amol Nirgutkar. I'm here with my co-host, AJ Peak, and welcome to Healthcare 100. It's the ultimate playbook for scaling healthcare. Each week, we sit down with operators, investors, innovators behind the fastest growing MSOs and DSOs and health tech platforms. And we try to unpack strategies, systems, capital structures that drive real growth. This is all about real growth versus fake growth. But we also, at the end of the podcast, we ask our audience to give us one good $100,000 idea that can move the needle within 3 to 6 months. With that in mind, where this podcast is turning leads into lifetime patients, I'd love for you guys, Heidi and Dan, to kind of give us a little background on who you guys are, and then we can get going.
Sure, I'll start off. Happy to be here. Thank you so much. My name is Heidi Arndt, and I started off in dentistry as a dental hygienist many, many years ago. Practiced clinically for several years before moving into the management side of dentistry. I ran my own dental consulting firm for many years. I sold that, then became the CEO of a DSO, and we sold that in 2021. In current day, I work as a fractional chief operating officer and enjoy working in the DSO space.
And I'm Dan Mirsky. I'm the Chief Information Officer at Sage Dental. Been at Sage for about 8 years. So I've had 8 years experience in dental, but had over 20 years in, almost 30 years in healthcare. So, I built many dialers and so that's why naturally I kind of have the PST as well, our call center. So always trying to maintain systems and try to find efficiencies and find ways that we can make things easier and better for operation and make just user experience, really kind of focus on user experience, making sure that systems are available and that our PST is supporting at the support center, supporting the operations in all of our practices.
Obviously, one of the challenges we see today in dentistry and broadly healthcare is acquisition of a lead, and call centers are being deployed by a not large majority, but a good portion of DSOs that are using call centers as the first line of defense when it comes to new patients. Dan, let's start this question with you. What do you think are the current challenges call centers are facing as it relates to inbound lead management?
Well, I think as far as lead management, we're getting all kinds of calls, and we're trying to get them to the right people. So really kind of divvying those up, making sure that the lead source is actually pushing to the right queues, making sure that the patients that are calling for insurance issues or just random questions and getting support, that they're getting to the right people in a timely manner, and then being able to parse out who is a new lead, who is a new patient that we really want to give a great experience and really get them streamlined into a appointment that works for them. So I think that's the major thing is really kind of thinking through how you've designed your inbound queues, how you design your system, and making sure that you're always watching abandonment rates, making sure that you know where all your patients are at all times and that they're getting to the place where they need to be.
And Heidi, a lead when they come through the threshold of dental office is a new patient. And I'm curious, the clients you're working with today and consulting, like what are the challenges in treating those new patients and turning them into lifetime kind of patients?
Yeah, I think, the patient experience has to be the most important part of what we're doing. And when a new patient comes into the practice, there's one thing that I see as a fatal flaw is when a new patient comes into the practice and is unable to see the hygienist the same day. Typically, these new patients want to see the hygienist that day. And when they're not able to see them for a cleaning, they typically will not stick around the practice. They don't have the time to come in 2 different times. So I think that's one fundamental thing that we have to focus on. And then, of course, treating them like roll out the red carpet for them is the other part of it, and letting them know that we are there to treat them for a lifetime as well.
The challenge I see, Heidi, in that process is that marketing is spent money driving that lead in. The call center has done its best job to schedule them in. A patient is coming for a new patient exam, and then we're trying to turn them into a comprehensive patient, right? For comprehensive dentistry. Unfortunately, we give them this experience that gets them to spend whatever the new patient special was, and then that's gone, right? And so all that effort that everybody put in from marketing to sales just goes waste when we can't get the patient into comprehensive dentistry. I see that happen all the time, and then somehow marketing gets blamed for it. Uh, so I love the fact that you said it's got to go through hygiene, and we've got to figure out, is it about getting the right blocks on the schedule to make sure that every new patient has the time that we spend with them to so that they can get the comprehensive dentistry they deserve.
Yeah, I do think it's important to have those blocks in the schedule. I mean, we do see in many practices that hygiene is booked out um, for weeks and weeks and weeks. And if we don't have that space for the new patients, number one, when a new patient calls your practice, they want to get in quickly, right? They don't want to wait 5 weeks. They want to get in within the next 2 weeks. So if we don't have blocks in our schedule to accommodate those new patients, we are going to limit the conversion on them, and also, of course, going to limit your ability to see new patients, which is not good. So you can market all you want, but if you don't have the space in your schedule to see them, there's an issue right there.
And Dan, how do you operationalize this? With Sage Dental, you guys have a number of offices, and is it all the same? Like, how do you make this work?
It's actually there's a lot to it. We're looking at, especially with our marketing, we're really kind of focusing rather than, across the board. Each of our regions are, it's very vast what we do for each one of those offices. If we have schedule availability issues, that's a great problem to have, but we're not going to spend a lot on marketing for that area. And then we also do a lot in our PST with, we're doing a lot of work on with the patient journey confirmations. We're doing electronic confirmations. We're doing voice confirmations. We're kind of along that route, and we kind of have our own algorithm as far as in our dialing system and patient journey that allows us to kind of we know who's going to be a no show for the most part, and so really kind of pushing those no shows into a different column, different production, so that we know that hey, they might show up, but we're going to open that up to somebody that will show up, that we know is confident that's gonna book and make that and keep that appointment for us. So we have a lot of things in place that kind of really help us to also, if we have cancellations, we're pulling those appointments forward and really kind of pushing patients into those blocks.
This is so fascinating. I've never heard this before, having the no show possibility guys into a third column or whatever ghost column you call it. That's fantastic. What do you guys do when you have no availability and a patient calls, needs 2 dental implants, $10,000 LTV at least, right? And you have nothing available for the next 4 weeks. What's the process there?
Well, I mean, we try to make it work, but the good thing is we're kind of hub and spoke in a lot of our areas. So we want to really look at what's best for the patient. And if we can get them somewhere close, also it's specialty. We have some really, really good providers and they're really sought after, really selling that value, selling the value of that doctor and making sure that they realize that, it is sought after and it's probably worth the wait if we can get you in on that schedule. So, our call center does really focus on building that relationship with the patient and kind of slow rolling and just kind of making them feel comfortable and confident and not being pushy and making it conversational, more conversational than a booking, than a straight booking.
And Dan, a lot of our audience might have 10, 20 locations, maybe not the resources that you have with the dialer. What would be a recommendation to operationalize, a fraction of this sort of double booking or a ghost column? Like if you had to do it with less resources, are there tools out there or sort of a simplified approach that they could kind of pursue?
A lot of ours are systematic. We've invested a lot into our back end systems. We've But, also I think the main key thing that anybody can do is really partner with operations, partner with clinical. Our call center isn't just a call center. It's not just in a building somewhere else. It's here at our support center. And we really, really focus on, I'm a big proponent of we are the support center. We're here to support the operations and anything that we can do to align ourselves and help their days be a little bit better, we're going to do it. So, we talk a lot about booking those inbound new patient appointments, but honestly, that's the priority. But we're really there to support and be aligned with what operations is doing out there. And I think knowing what's happening in the field really gives us a lot more insight as to how we can help the patient get to where they need to go.
I love you said that a lot of folks, organizations, as they're growing their DSOs, forget to focus on the clinical calibration aspect of it, right? We've got to get the doctors and the hygienists on board in order for us to produce revenue, right? We can't just like, okay, well, this is marketing, this is my call center, and then we don't have the people on the other side, the clinical side, supported, right? And so the question for you, Heidi, in this regard is, how do we really bridge the gap between operations and clinical? And what do you see? What breaks down? Because we've got to get, if our producers don't buy the whatever we're doing, then it all falls apart. No matter how good the AI is, Patient Prism or otherwise, it doesn't really matter. What matters is, are we aligned?
And why did you brought that up? Because, yeah, there is a bridge that has to be built. I think what I see oftentimes is operation and clinical operate in their own silos, and there's not a lot of cross training. I like it when you can cross train those same teams. I'm not saying take a treatment coordinator and turn them into a dental hygienist or anything like that. But here's an example. If treatment coordinator is presenting a crown to the patient, they need to know what a crown is. They need to know why we're placing a crown, why we're recommending a crown. Same thing with implants. They need to understand the clinical significance. And on the other side, we do need to understand operations and what they are doing and the challenges that they have. Oftentimes, we're not talking about those cross lines. We are keeping them very much separate. When I think about the front office and treatment coordinators, they are clinical translators. And so if we're not spending the time working with them, we're going to have a break.
So training is a big component, right? We've got to train people constantly about everybody else's job as well. Because, what do I do? I mean, at the end of the day, when a patient asks a question about, hey, I have type type 2 diabetes, my A1C is 8, and I'm looking for dental implants, we want to make sure our agents are well equipped and like, hey, we handle a lot of people with diabetes, and we can help with you. We can work with your primary care doctor to make sure that this is and if we don't train these folks on around that, then the patient's not really moving forward. So it's a great point.
So curious, Heidi. So new patients in the office, they're now in the operatory. Like, what's the top couple kind of killers of case acceptance that you just sort of see, the common mistakes that really, don't really ignite these new patients to become lifetime values?
Well, the one thing that I've been seeing a lot recently is the lack of soft skills and even just getting to know the patient on a personal basis. Um, these patients want to get to know you, dentist, you, hygienist, on a personal level and have that be comfortable in the chair. Because as soon as we can break through that barrier of being guarded, the patient being guarded or concerned, number one, it's going to make them comfortable. Number two, if they like you, they're going to be a patient there forever. I'll give you an example of my dad. My dad, of course, he's going to the dentist like everybody else. He was seeing a new dentist in town and he was really unsure about this dentist. But because this dentist loved the Seattle Mariners and loved baseball, they got along perfectly because that was my dad's interest too. So they had something in common that he immediately attached to, and he'll be a patient with that dentist forever just because of that one thing. He has no idea what kind of dentistry this guy does, but he does know that he connects with him on a different level. So I would say that's the number one thing. And then showing the soft skills that you truly care about that patient as you're talking about treatment.
And I know when we had 10 locations, um, it was really hard to coach and roll that out. But like, how do you work with clients when you sort of broach that 10 and you can't be at all places at all times? Like, how do you scale up the sort of soft skills training?
It's hard. I would rely a lot on the one-to-one coaching, but you're right. It's hard to do that when you have multiple locations. I do think that training has to go through the entire organization. So I'd want the operations managers to understand what that new patient appointment looks like, how to train on soft skills, almost script out exactly how you want it to look. I've seen some groups make a video to show exactly what that looks like. I think it's also something that you have to continually to discuss, and it should be part of training for every level of the organization. Soft skills is a hard thing to train, honestly, because it's part of your personality. And if you don't have the personality that has the caring or supportive or even the soft skills just as a human, that's going to be a tough one. But I think we have to lead them as best as we can by providing examples through training.
As going back to the call center a little bit, we're seeing obviously at our platform, we see tons of challenges patients are facing right now. Insurance is a huge challenge, especially in the last 8 to 9 months. We're seeing almost 40% of patients not scheduling an appointment because of insurance obstacles. And let me share this insight. So we do lots of root cause analysis on our clients, right? That we like figure out like how if you break down a DSO into its top 20% offices versus the bottom 20% performance wise, we see the top 20% offices somehow on a decentralized manner. They have a much better understanding of how to deal with insurance obstacles versus the bottom. But when you're in a centralized way, is there anything specific you're doing at Sage that allows you to have better conversations around insurance obstacles? Medicare Advantage is a big deal right now. Everybody wants those patients because they pay more. Medicaid is a tricky thing to deal with. What's your current thinking around dealing with insurance obstacles?
I definitely think that, yeah, it's a major thing. And we start to see, as we see trends, because as we're centralized, we're going to see all the calls. We're going to see everything coming through. We're going to start seeing those trends of, okay, we're starting to see this carrier's having more questions, a lot more insurance questions there. So again, I think being part of the support center, being there in breaking those silos down, working with our RCM teams. I'm looking at right now, even building a small little team of, insurance people that can handle those higher level things, because before that was at the practice level. A lot of stuff was practice level. So you don't really, it's kind of, you hear about it trickle back up to the support center, but you don't really hear a lot of it. But when you bring it all together, you start hearing that it's happening everywhere. You start to be able to address that, build some scripting around it, and be able to route those calls faster. And then have those in your scripting, have those answers or top of mind, so they can be addressed very quickly.
And the scripting is probably a good answer, right? To like, okay, here's the common things. We're not saying we should be scheduling every Medicare Advantage patient, period, right? We should be scheduling that. We're not scheduling even 60% of them. Part of the reason is people don't know, right? And that scripting needs to be, and that's great. I love the fact that you're creating a tiger team of people who are insurance experts. So if there is a challenge about, yeah, I don't know for sure, we can obviously get that elevated so that people don't have to not make an appointment because of that obstacle.
And Heidi, what's the best practice? Like the inevitable patient comes in and says, unless insurance, covers it, I'm not going to do it. How do you work with teams to sort of overcome that common objection?
Yeah, so that's a good question. I'm going to take it back to the front office because I want to talk a little bit about why insurance is such a challenge for the patient, as in making it the most important. So I'm going to take it kind of from the front and then I'll go to the back. So one of the most common things I hear from the front office is we always want to talk about the insurance first without talking about the value of a treatment. For example, if a patient is walking out with a treatment plan, usually the first thing the front office will say is, I looked over your insurance breakdown and your portion is going to be this. Or using phrases such as, your insurance only covers this or doesn't cover this. So I think we've trained our patients to believe that if insurance, doesn't offer you a good benefit or it doesn't offer a benefit, you just don't do it. Same in the back. Typically, they're going to see the insurance verification breakdown, and I see a lot of them using that as a guide of how they're going to treatment plan. Now, there's two ways to do it, right? There's a really important factor in making sure patients understand the impact of the financial part when we are treatment planning, and we also want to get reimbursed, right, for what we do. But I would really ask, the thing that I've always trained is look at the patient's needs first and tell them exactly what they need, the most ideal treatment. And then if you have to adjust because the patient's concerned about the financial part, you can make an adjustment. But every patient should know what the ideal treatment plan or ideal treatment is for them. So don't use insurance as your basis for treatment planning or anything like that. Really focus on what that patient needs.
I think it's so important, right? Because I think sometimes the self-limiting beliefs that people have kind of prevent them from like having those conversations because they feel guilty. Oh my God, it's going to cost $3,000 and it's a lot of money for me and I don't have that. And so the patient may not have that and I'm going to feel guilty about that. That's probably the primary reason why people don't even offer financing.
That's
Like,
right.
is because it's my belief that it's not good. And so I'm going to put that belief on the patient when actually doing the treatment is going to actually be cheaper for the patient in the long run. And somehow there's a whole psychology behind that, right?
There is this great point. Well,
Um, One of the challenges, Dan, that we also see around in getting people to book an appointment I'll get back to this whole idea of membership plans and patient financing. How are you training your agents at the front end of the conversation when the new patient calls and they are concerned about affordability? Uh, do you guys, number one, how are you training in terms of like offering this at the very outset? Like, hey, no problem. We've got care credit. We got whatever we got. We've got the dental plan that gets you covered for most of these things. Is this is this happening at the front end with you guys?
No, it is. It's definitely, I mean, I feel Heidi's challenge in the practices when, you treatment plan and all of a sudden the insurance, because a lot of the practice management systems don't do a really good job of estimation or getting the insurance right. So that can cause some challenges. So we try to head it on at the beginning of the call. As we're booking the patient, we're getting all that information, but we're also giving them options. We are heavily scripted. We have a really great QA team that listens to the calls and really kind of helps to kind of guide our call center agents in real time, all the time. But we do have a lot of good options. We have a finance waterfall, which kind of takes into account every type of patient. So not just, the ones that really probably don't need financing, but then the ones that really do, and the ones that are going to have a real big challenge, and they're going to have to pick which dental procedure they really need done because they need all of it done, but they can only afford so much of it. So we kind of give them those options, and then we also have our Sage Care Plus, and Sage Care Plus is a big motivator because it's got a lot of value for the patient. It really kind of gets them into that, gets them a discount on a lot of those procedures, gets them their cleaning, kind of really helps them to kind of get there. So we kind of have a lot of options, a lot of scripting around those options to get that patient motivated and empowered.
I think it really goes back to the soft skills Heidi was talking about. I think we've got to figure out how to eliminate barriers that our patients may talk about or not, right? A lot of people don't talk about that. Oh my God, I can't afford this because it's kind of shameful to like feel that, oh my God, I can't even afford a $500 treatment. But if you are forward with that, if you come like, by the way, we can make this affordable with you guys with our Sage Care Plus. We've got a financing waterfall. We can make this affordable for almost everybody. So don't let that be the reason you don't make this appointment. We want to come here. We love new patients, all that.
And Heidi, in the hygiene chair, what do you find to be the best practice? Who goes through that conversation? The hygienist, the treatment plan coordinator, or the dentist, someone else?
Yeah, so I don't love it when the hygienist is having the financial conversation. Number one is you talk to almost any hygienist and they don't want to have it. They're uncomfortable talking about the financial side. However, if a patient is expressing a concern about being able to pay for something such as scaling or rope planing, they should know about the discount plan or the membership plan or financing so that they can put them at ease. And really, it comes down to communication again. It's like acknowledge that the patient has a concern about the financial side of the treatment plan. And just acknowledge them and say, we have, like Amal said, we have options for you that I'm sure will help you get the treatment that you need. So, using those skills, I do think the hygienist needs to understand the financial part, needs to understand insurance. Again, this that cross training that we have to have, but I prefer to have the financial discussion done with the treatment coordinator at the front.
That's a great point. I think what you guys are saying is that we've got to really optimize this communication across the entire journey of the patient, from the very beginning when it starts to all the way at the end, and even on the reappointment level. Um, then the question is again, as AJ said earlier, there's a lot of audience um, for this podcast who's going to look at this. They're in their 10 to 30 location kind of space. What technology wise? I mean, remember, number one question is, at what point do you need a call center to answer new patient calls? At how many locations, right? And is it imperative to do that? Number one. Number two, what other technologies are accompanying with that you absolutely have to have in order to run a good inbound as well as maybe an outbound campaign, right? Because you need to do follow-ups, confirmations, all that stuff.
Yeah, I mean, when I got to Sage, we were at 59 offices, so the PST was already kind of in place. They had scripting, they had, some of the basics, but again, they were just using the regular phone system that the practices were using. I think a dialing system really does help, and there's different dialers at scale and at all levels of scale. So, we use Genesis because I'm familiar with it. I've implemented it numerous times, but it's one of those things where I think partnering your partnering your practice management with your dialer and just bringing all that together, it really is important to know what your patients need and being able to execute on those needs very quickly. We do inbound, blended, and outbound. When we have an initiative, I can quickly go and kick that off, the next day to really, make sure that I don't lose any opportunities, making sure if it's oral cancer screening and, those types of things, I can truly execute quickly. But I think you can do that at all scales. But I think it's really important to have, like you said, that tiger team, that's even if you're having just maybe 10 offices, having people that are really, really good at working with your patients. Because again, they have to be trained, they have to have scripting, and they have to, like, for us, we try to keep keep it conversational. Keep it, conversational and understand what the patient's looking for, low pressure. But there's training to that. There's soft skills that doesn't just happen naturally. You have 60 diverse people in a room that you can get them to speak the same language over time. I think that's important.
Let me ask a super tactical question here. You said you have, the dialer. That's great. You're saying you recommend the call center maybe around 10 locations or up. It's imperative because you don't want to inundate the office with more things to do. They already have tons of things to do, especially with new patients. Uh, let's look at a scenario. 3 weeks out, you're sitting here, like, let's say beginning of June, and July looks super sparse, right? We've got 80% occupancy, not 80% lack of occupancy, rather. We have 20% occupancy rate. So 80% of slots are not filled. Like, okay, well, what's the campaign you're going to do now, like, to get the seats filled up? Yes, you expect maybe another 25% to come from new patients. And let's say you have 50% slots for existing patients that are just empty. What's a good campaign?
So, I mean, on a daily basis, we're doing our missed and canceled. Anybody that missed or canceled their appointment, we're dialing up the next day, see if we can get them back on the schedule. And again, that goes back into our algorithm of will they show the second time? And so, we do track those results and, but in addition to that, we want to get people in the hygiene chair. That's the first step. Get them in the hygiene chair. So if we have hygiene availability, let's get those patients in there. Let's look at um, who hasn't booked their appointment yet. So we're going to look at our hygiene campaigns. We're also going to look at, once we've exhausted our hygiene campaigns, we still have availability. Maybe we want to look at patients that we saw a year ago, and see maybe life just got crazy for them, and we just want to get them back on the schedule. A healthy mouth is a healthy body. That's where it starts, and it's one of those things where we really do truly care about our patients and want to find ways to get them back in the hygiene chair.
So, through skills like Dan, the schedule's robust, Heidi, and maybe a client of you, founder calls you desperate and wants you to measurably improve case acceptance, maybe double it or measurably improve in 90 days. What's like the top 3 things that just about every small scaling group, you just know these 3 things are going to be the first 3 things you cover to get results?
Well, number one, I believe the handoffs are so important between hygienist to doctor during the exam. Um, the assistant to the front office is very important because we have to relay that information through the practice, not only what the treatment plan is, but the urgency around it. Number two is communication. With the new graduates, the last few years of dentists, I have noticed a really big lack of good communication with the patient. I think it's a lot about how their education has been the last few years. I even see it with the hygienists as well. There is a lack of ability to communicate clearly with the patient of why they need to have the treatment, putting the urgency around there, and really being that person that influences them towards the treatment, if you will, helping them guide the decision of where they need to go. And then the other place where I see a lot of things falling off is the front office, of course, using terms of like, would you like to schedule? Giving them so many options that they really can't make the decision. And again, always leading with insurance is a real difficult thing. So I think to wrap it all up is communication in every way that you look at it. It's taking time to train your team on communication. Think about dental school or hygiene school. We're not taught communication. The communication that I had when I was a hygienist is trying to teach the patient how to brush their teeth in a modified VAS method. I mean, that was my treatment presentation. So it was nothing about influencing the patient towards care. And same with the dentist these days, same situation. And then no matter what your hiring experience is or the practice that you have, not a lot of time is spent with the front office as well on communication. So being assertive and guiding that patient. Again, we're guiding them towards a decision. Don't think you're selling. Don't ask them a yes or no question, but guide them to the best treatment.
And what are the like quintessential words that work that you coach teams to create urgency?
So urgency, I don't know if there's just one word that I coach, but I will always rephrase the reason why they need a treatment. And I think that's the most important. We're very concerned with, or what I'm seeing today is, and if we don't treat this, this will be the result. Those I think are the most important phrases that I would like to use is really focus on why it's important. And if we don't treat it, this is what's going to happen. Not a scare tactic, but just letting them know the result if we don't get this treated.
Dan, what's the big idea that these DSOs can go out there, implement right away to drive? If there is one big idea that you're coaching somebody and saying, hey, from my perspective, you got to do this, and it's gonna, I'm not asking you for a silver bullet, but something that is just that you guys have done that works well, everybody should do.
I think organizing your team using some kind of a system, whether it's a CRM to aggregate some of that data to understand your patient base, understand what their needs are, I think a dialer helps immensely at any scale, just because of the fact that it's going to streamline the experience for both the agent and the patient. They're really gonna you're kind of putting them through a process, and that scripting comes in, those barriers come in, and those barriers are really kind of to help the patient. They don't understand the things that we see on a daily basis. So being able to really kind of put that in a knowledge base to share with with the patient base, I think is super helpful.
Yes. So I'm going to come from a little bit different. And I mean, I agree with communication is everything in the part of, but if I had 6 months to do this, what I would do right today is I would create almost a campaign in the practice to implement a focus on either AI with radiographs or, do an Invisalign campaign towards the end of the year. And what I would do is show every person in the office how it works and what we're trying to get out of it. So if we're focused on using AI to identify periodontal disease, make a huge educational campaign around that and make sure everybody knows why it's important, how we look for it, how we're going to talk about it at the front office. If it's clear aligners, do the same thing. We're going to use the scanner. This is how we're going to talk to the patient about the scanner and take the entire patient journey of that treatment plan. And what happens is when you do a campaign like that, it's easier to do another one and introduce another concept. Plus, as you know, like Dan was saying too, the communication that you learn in that campaign is going to feed everything else that they're doing. So if I had one big push that you'd make, I'd make one focused campaign.
Heidi, Dan, incredible. Just insights. Thank you so much. I wish I had access to you when I had 10 locations. Might have sped things up for me measurably. So thank you both so much.
Thank you.
Thank you, guys.